So today a muscle which everyone will see it as a pride to ourselves, both men and women, and then we try to flex often among each other. Okay, so everyone will have a guess it is biceps brachii. Glutes.
As close.
So biceps brachii. So as we all know, the original insertion it has two heads. That's why it's called biceps. And why is it called a brachii? Brachii means arm, so that's why it's called brachii. So the origin, there are two origins for it. The short head is from the coracoid process of the scapula, and the long head origin is from your supraglenoid tubercle of your scapula again on the glenoid cavity, insertion into your radial tuberosity, okay, on the radius. So this is the original insertion. We all know the movement. What are the action of biceps brachii? Elbow flexion, shoulder assisting in shoulder flexion, and then there is another movement also, which is supination. Supination of your forearm. It's done by your biceps brachii also, and then the important action is stabilizing your shoulder. So when you're lifting a heavy weight, why you're feeling in your biceps a lot, because it's a stabilizer to bear the load which you are lifting it. So this is about biceps brachii introduction. So when it comes to the trigger points, how the trigger points happens or how the trigger point occurs in the muscle is basically while doing overdoing of exercise or overdoing of daily activities. So overdoing means every day we'll use biceps for all the movements which you are either cooking, either writing, or doorknob opening of your, doorknob opening, screwdriver. So everyone, in all the profession will have usage of biceps brachii. So it's a most overused muscle in our body. So it will get tightened it will be tight for everyone. It will not be weak. It will not be weak for anyone unless if they have a paralysis, it will be weaker for them. Other than that, no one will have weak biceps brachii. Okay. So there are two major points. One, the muscle, the trigger point will be present in only the muscle bulk. So we all know where the muscle bulk is. This was the one. So medial and lateral. There are two heads, medial and lateral. So you can you can self-release to yourself for this muscle, but you should give little more pressure because it's pain tolerant. As we are using it every day, it's pain tolerant. So you should give much more pressure to release it. So this is about biceps brachii and how to release it. I'll just tell you. So just stabilize it from posterior. It's what stabilizer in Suma. It should be in rested position always. Okay, it shouldn't be like fully stretched or fully flexed. A medial neutral position. So just grab it on the muscle bulk. So there's another way also to find it out. If you have any, we have a cream over upstairs, right? Cream or any oil. This is the origin to insertion point. Just rub it. Wherever the knot is, the knot will move laterally. So because of friction, I couldn't able to do it. So wherever the knot is, you can feel the bulk over there. So you can feel it. So that's the one way you can find it for biceps brachii especially. So usually the trigger point will be present in the center. There's a muscle bulk, and then try to grab it lateral and medial, and then just move it. And then for medial, same. Go towards the medial side, and then move it. Medial is more prominent than lateral. So these are the two major trigger points which you can see. For some people, for overhead athletes, they have a trigger point in the coracoid process, near the coracoid process, this area. Exactly over this area, we have a trigger point. So this is about the biceps brachii. So yeah, that's it.
This is long.